it's time for your healthy dose of information from Hannibal Regional Hospital, Hannibal Regional Medical Group, and joining us here in Studio H, it's Lynn Olson, who's the CEO of Hannibal Regional Hospital. Good morning.
Good morning. Thanks for having me.
Hey, thanks for joining us this morning. Thanks for coming in for News Talk Live. Tell us what's happening at Hannibal Regional Hospital. You guys have had a busy week during Nurses Week this week.
We have. We kind of got kicked off this week with Nurses Week and had a lot of things for our nursing staff, our LPNs, our RNs, and our techs. And so we did some education, sponsored a great speaker at HLGU, and just had a breakfast that was served by our physicians for nurses, just to kind of recognize all the efforts that they put in.
And sometimes those efforts kind of go unrecognized, don't they, throughout the year? I mean, I'm sure that as an organization, you try to stay on top of that, but I think that for the customer, for the person who's receiving care, whatever area it is of medical treatment, you tend to overlook the fact that these nurses come in every day and just do an amazing job of serving people.
Well, no one is by the bedside more than a nurse with the patient, and they're both doing a lot of technical care, but also compassionate care.
Right.
I think that's the part sometimes we overlook. People go home, they get better, but it's really that caring that gets demonstrated by that nurse throughout that patient's stay that they remember.
And this coming week is actually another big week for you over there because it's Hospital Week nationwide, and I know it looks like you have a lot planned coming up for this week as well.
We do. So for Hospital Week, we kind of celebrate everybody that works in the healthcare system, and so we've got a lot going on, both for our team members, but also some things for the public. Mm-hmm. So Monday, we're just going to have a little popcorn festival for our staff, and so we'll be cooking popcorn for them all day, and the place will smell like popcorn. So that'll be fun. On Tuesday, we sponsor our Women's Health Fair, and that's from noon to 4 p.m. We're doing a variety of screenings for the public, including mammography for women 40 or over, bone density for women 50 or over, skin cancer screening, which we're actually doing throughout the month. And then we just have a number of booths, information on diabetes, heart disease, vision, sleep disorders, healthy eating, and so on. And so that's all free. The screenings you do have to sign up for, and I've got a phone number.
Okay, sure. Yeah, if you can get that out. We'll get to that. The screenings are a big deal there at Hannibal Regional because you have screenings for a number of things throughout the year. And the great thing is you do offer those to the public so they can get a little diagnosis or maybe some determination of what's going on with them.
We do. In fact, we started a couple of new ones here in just this last couple of months. Calcium scoring, which is a CAT scan-based test that helps determine if you've got plaque building up in your arteries, and that's a very reasonable test. We do them every week, and it allows people kind of in a non-invasive way to find out what's going on inside their vessels. So that's one of the newer ones. But we do a variety from, again, skin cancer, healthy foot care, vision screening. We'll do them throughout the year. And it's amazing that we'll find people who didn't know there was something potentially wrong with them that pops up during the screening.
Right, and it's good that they find that out and they're able to get treated right away before things get worse.
Right, because we'll try to pair them up with a local provider, and then they can get it checked out. Sometimes there's really nothing to be done. Other times there's follow-up needed. So we are a big believer in getting your preventative care done and your immunizations, as well as getting checked up on a regular basis.
Okay, and you'll be doing that again, as you said, next Tuesday, May the 12th, with the Women's Health Fair. That will be right on site there at Hannibal Regional?
It will, again, noon to 4. Actually, we'll be doing mammography until 7. That fills up pretty fast. So you do need an appointment. The number to call is 573-406-1639.
Okay, what else is going on next week?
Well, so then for staff on Wednesday, we're going to do breakfast on the go. Just we pack a breakfast lunch. A lot of our staff, they don't waste a lot of time. They have to get in and get to work. And night shift folks coming off or going home, so we're just going to give them a little box breakfast. On Thursday, we're just going to give everybody a gift card for lunch. If they can't eat at the cafeteria, we've got a gift card for a local restaurant. And then we're also going to have a baking contest for our team members, so you can make your favorite recipe and have it judged by your coworkers, and then we'll announce those winners on Friday.
Okay, and that's all during hospital week, and the events just continue on. You've got more next week, too, right? You've got the favorite HRH shirts.
Well, yeah. On Fridays we try to have a little bit of fun, so we allow people to wear logo wear. So you can see I've got one on today.
Yeah.
And we have a variety of things. People have special weeks. So a couple of weeks ago was Lab Week, and we have Medical Imaging Professionals Week. So we say wear your favorite shirt that day and promote your department as well as the health system.
I noticed too, when you mentioned the shirt that you have on, you have your logo on there guiding you to better. What is getting better about healthcare in 2015?
Well, when we talk about guiding you to better, the healthcare can be a very confusing atmosphere to come into, and it's got unusual terminology. And so what we're trying to do looking forward is to simplify that and provide information on health options. And so the guiding you to better is a way of guiding you through that system. A good example is in our cancer care. We have a care coordinator, Belinda Kirchlich, I think she's been on here before, who is just there to answer your questions about technology, about chemotherapy options. And that's the kind of thing we're looking at adding in other departments as well, just to provide information, maybe a shoulder to lean on, and just a compassionate ear to talk to about what you're going through.
Do you feel like the approach to the patient is becoming more and more personalized?
I believe so. We're trying to take a more patient-centered approach, and the questions we're starting to ask is not what's the matter to you, but what matters to you. And
That's a good point.
Amazed to find that sometimes what matters to people is not the technological interventions, but it's understanding what's wrong with them. It's understanding what they need to do about it once they leave us, and to really understand the disease. And so we're trying to be better at explaining what we're doing, explaining what the disease is and what they have to do to stay healthy once they leave us.
And you mentioned the technology too, and that is a big part of the process. You've had some great new technology added recently at Hannibal Regional.
We have. It's just, we're kind of that point in time. Our building's 22 years old, and we're just in that kind of round of replacement. So we replaced our cancer treatment equipment recently. Our new linear accelerator went online in December. We've replaced, or we're in the process of replacing our MRI, so we're sticking some remodeling money into a new suite, and then also we'll be buying a new unit here this summer. And then our nuclear scanner is new this past year. That was about $1 million investment. So none of these are inexpensive.
Wow.
That's just a few. We're also remodeling inside the hospital on a kind of a continual basis, because we're just, at that point, we have a beautiful building, but it is 22 years old.
Yeah. So you're doing what you can to make it better, and always looking ahead and looking toward the newer things. I thought it was neat that you mentioned MRI there, because, wow, over the years, how much has MRI changed, and how much better is it for the patient these days, and it continues to get better?
Well, it's amazing, really. And when you think back a few years ago and how you took pictures on film, mm-hmm. and then originally with very small memory-sized cameras, and now you can get 12, 15 megapixels. The resolution's incredible. Well, our technology's evolved. It's much more sophisticated than a camera, but it's evolved similarly. And that the resolution on the images is so much sharper. The 3D imaging and looking at the body kind of from a back-forward side perspective is just amazing to look at, and in color, not just black and white like the old X-ray films. So it's really amazing. I had an MRI last week for some issues I've got going on, sports issues, and to sit there and look at those studies with the doctors is just unbelievable.
Does it give you new insight when you're the patient?
Well, yeah, it does, actually. It makes you a lot more empathetic with what they go through, and our team did a great job with me, but it was an interesting to be on the other side of it, and I think it gives you a more empathetic perspective of what patients go through. And I work in the business every day, but still I don't know it all, and I enjoy when people explain things to me too. And
right.
So that's why I was proud of our team and how they treated me, but also I know that they'll do that with every patient they come in contact with.
That's good. It gives you a good perspective of what the patient goes through and what the staff goes through at that time too, when you become the patient yourself. What about anything else on Nurses Week this week? You've had a good week at the hospital.
We have, but the patients don't slow down just because we're celebrating. So we've had a pretty
mm-hmm.
busy week at the hospital. It's really been a busy 3 months. But the staff just keep pitching in. They take a little time out to have a little fun, but it's back to business when those patients roll in the door.
And the business continues with Nurses Week this week, Hospital Week next week. And we appreciate you coming in this morning. Anything else today?
No, just thanks for having me. Appreciate
Thanks for
the
coming
time
in.
to talk with you.
We appreciate it. It's CEO of Hannibal Regional Hospital, Lynn Olson, here on News Talk Live. Thanks for joining us this morning. Come back again.
I will. Thanks.